Good evening everyone. Welcome to a new episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Health is not valued until sickness comes. In this talk show Health World, we have expert doctors from various fields discussing and providing valuable information on various medical issues so that you can keep diseases at bay and enjoy good health. Studies reveal that 1 in 7 women suffer from chronic pelvic pain. This can be quite frustrating as it affects your normal life, your daily activities, and eventually it can even take a toll on your physical and emotional well-being. Today's topics of discussion is chronic pelvic pain, pelvic inflammatory diseases and health screenings. To throw more light on these topics, today we have with us a very senior and eminent gynecologist from Alhilal Hospital, Manama, Dr. Krishna K Ramavath. She is internationally trained, she is an MD, MRCOG, she is a member of the Royal College of Obstetricians and Gynecologists UK. She is also FICOG and her subspecialty is gynec oncology. And she has also authored a book, Smart Life at 40 Plus, which talks about women's health issues and screenings after the age of 40. So let's move over to her to know more about these topics. Doctor, thank you for joining us on the show and welcome to the show.
Thank you for having me here on the show. Thanks, Anupama.
So what exactly is chronic pelvic pain?
So chronic pelvic pain is a very common condition in women where women experiences pain in her pelvic cavity, that is below the belly button and somewhere in between the hips. So the pain is chronic because it's more than 6 months or so, and it can be sometimes very constant pain, a squeezing pain, or on and off comes and goes kind of pain. The patient actually suffers a lot with this.
Okay, so chronic pain means one that has been going on for a long period of time. So normally when a patient comes to you, what is a typical scenario? I mean, why does a patient visit you? What are the symptoms that you look out for?
Yes, that's a very good question. Usually the women who come with chronic pelvic pain, they constantly complain to a gynecologist that this pain has been bothering from so long
time,
and they have taken various treatments. By the time they come to the doctor, to us, they must have had extensive workup, investigations, even some major surgeries like a gastrointestinal surgery or a gynecological surgery, or uterine procedure or an ovarian procedure. Still having years of checkups for a pelvic pain, they don't find an answer for it and they still have the same pain. So this is how a typical scenario would be.
So what are the causes of chronic pelvic pain?
So because the pelvis is pelvis contains uterus, ovaries and tubes, and it's always in between the bowel up and bladder below. So all the organs, they have an intermix of symptoms. Usually you don't find a diagnosis, but main causes could be pelvic endometriosis. So endometriosis is again a condition where the inner lining of the uterus which bleeds, which sheds, it grows outside the uterus, either on the bowel or bladder or ovary, and this causes intense pain for the women. And or it can be pelvic adenomyosis, where the muscle, the endometrial layer that grows into the muscle of the uterus, and it causes severe pain during bleeding. Or patient can have pain because of previous surgeries that she underwent, like a cesarean section or a hysterectomy or any intra-abdominal surgeries. So there are flimsy adhesions between the organs post surgery, and she can have a constant pain because of the adhesions. Or she can have pain because of sexually transmitted infections like a pelvic inflammatory disease. It could be an ascending infection and it could affect the tubes, ovaries and uterus. There will be constant pain. Other than gynec problems, she can also have other intermingled organ problems like a bladder pain syndrome. It's called also interstitial cystitis, where the inner layer of the bladder is inflamed and patient can have pain while she is peeing. Or the pain can be related to a gastric problem like irritable bowel syndrome, where the patient comes with bloating sensation, diarrhea or constipation. She has this chronic pelvic pain which is going on for months together and she doesn't find a solution for that.
Okay, so as you mentioned, there seems to be a wide range of causes.
True.
So do you think it's difficult to diagnose chronic pelvic pain?
Yes.
To point out the root cause and
Correct.
to find out what exactly it is?
Right. It's really difficult because it's an intermix of
so many other
organs,
factors. Yes.
coming in and causing a pain. It's often very difficult to diagnose, and sometimes there is one condition which is undiagnosed in this women is called a pelvic congestion syndrome, where have you heard about varicose veins of the
Yes,
legs?
that affects the legs, right?
Exactly. So it's the varicosity of the abdomen. So ovarian veins, they are very tortuous, engorged, and these veins don't have valves. So there is a backflow of blood whenever women has intra-abdominal pressure, like if she exercises or if she does a long walks or if she does some heavy work which causes a pain, increases the abdominal pressure, pelvic congestion occurs. So this is very not diagnosed very early in these women.
Okay, so what are the tests that you normally advise to find out the root causes?
So when women comes to us, usually we try to elicit her history. So we try to see what exactly is causing her pain. Is it related to her any sexual activity or any medical disorder which is causing this? So we do examine her, we do a general vaginal examination, check for STIs, take out some swabs, and also do a urine examination to see if there is any urinary infection, and the best investigation that we would go is for ultrasound. So this usually diagnoses if there are any cysts or any pus collection or if there is any pathology inside the uterus or ovaries or any pelvic region. So sometimes when we don't find an answer, we go for laparoscopy. 1/3 to 1/2 of women who undergo laparoscopy, they don't even find the answers because it may be negative, but we do because if there is endometriosis, we see and treat at the same time. And then there are many other infections that tubo-ovarian abscesses or because of pelvic infection we can see and we can treat them. So laparoscopy is a test which we do it for a higher kind of women where they suffer a lot. And then we also do a colonoscopy and a cystoscopy. Cystoscopy is putting a camera in your bladder and seeing whether the bladder wall is inflamed or not. So these are the higher procedures that we do.
Okay, so urine test is the basic, and then depending on the severity of the condition, laparoscopy, cystoscopy,
yes,
and all that. Okay.
Yes, that's
so how is this condition treated medically?
So chronic pelvic pain, as I've said, it is difficult to diagnose, yet it is difficult to treat.
Treat also. Okay.
So main thing is we actually create awareness to the women first of all, so they understand what exactly is causing pain and how is the pain relief. So if we find a cause, then we definitely treat the cause. If it is an endometriosis which is causing her the pain, we treat the endometriosis with hormonal suppression. We suppress her menstruation and we treat it. If it is a pelvic inflammatory disease which is causing, we put her on antibiotics and also treat the partners. Or if it is a gastric problem like an irritable bowel syndrome, we collaborate with the gastrointestinal surgeons and then we treat her. So it's mainly when you know the diagnosis, you treat it. Otherwise, it's a holistic approach. We go ahead. We ask the patient to have some lifestyle modifications. She has to maintain a pain journal.
Okay.
And then for about like few months, then she will note down exactly when is she having this pain, what makes it better, what makes it worse. Is it related to her sexual activity? Is it related to some work that she's doing, exercise? Or is it related to any kind of food or some drinks? So we ask her to maintain a pain diary, and then a holistic approach will be given, diet modulation, exercise, and also she can talk to the counselors. Sometimes women with pelvic pain, they are a little depressed because they don't find the answer and solution for their pain. So talking to a counselor eases them because it tells exactly where exactly her problem is and how to cope up. So when she knows that, treatment for the patient is easy. So when we don't know the diagnosis, at least we give a symptomatic relief for her.
Okay, so as you mentioned, I think self-awareness is also very key. As a lady, you need to understand what changes your body is going through.
Right.
So what ideally, when a patient is suffering from this chronic pelvic diseases, what are the things to look out for? What are the factors to be kept in mind so that she knows more about this condition, and what are the lifestyle changes? You suggested some lifestyle changes as well.
Correct.
So if you could just elaborate on that.
Right. So it's again, women when they come with chronic pelvic pain, it's a shared decision making between the women and the doctor. So gone are the days where we are paternalistic attitude. The doctors say that this is your problem, this is the treatment, and patient devotedly follows the treatment. No, medicine has moved forwards. we have a patient interaction, and it's a shared decision between the doctor and the patient. She knows her problem, and we give her the options of treatment. If it is endometriosis, we give her options of a hormonal treatment, a surgical management, or putting an intrauterine coil. So she chooses her treatment, and she understands what is best for her, and then we support her in the treatment, and we walk through the journey together. So women should know when she's coming to us what type of questions she needs to ask a doctor to find out and how best she can take care of herself. And at Al-HILAL, coming to the chronic pelvic pain management, we have a multidisciplinary team of doctors. So me being gynecologist there, and I have a urologist, and we also have gastrointestinal specialists and a physical therapist. So it's a collaborative multidisciplinary approach that we treat the patients. And if you feel that your loved ones or you are having such pain, you can come to us, and we are very confident in treating you, and you can check out on us.
Good to know that. I think ladies should seek prompt medical care, rather than, in most of the cases, ladies ignore their own health and they're looking after the families.
Correct.
But I think it's very important that we take care of our health as well.
Right.
So while talking about chronic pain, you also spoke about PID, pelvic inflammatory diseases, as one of the causes.
Yes.
So could you please elaborate about that? I mean, what exactly is pelvic inflammatory disease?
So pelvic inflammatory disease, again, as the name suggests, it is the inflammation of the pelvic organs. Again, the pelvic organs being uterus, ovaries, the tubes. So this is actually pelvic inflammatory disease is caused by a bacterial infection which can occur through an unprotected sexual intercourse. So women may complain again of infection, pain,
okay,
fever, and such kind of symptoms.
Okay, so what are the risk factors in PID, pelvic inflammatory diseases?
So the risk factors, because it's a sexually transmitted infection, the most common causes would be gonococcal infection or a chlamydial infection, and the risk factors would be young age, I mean around under 25s or between 25 to 29, those who have unprotected sexual intercourses, those who don't use condoms, or those who actually have history of previous STIs or PIDs.
They are more at risk.
Yeah, they are more having risk towards a pelvic inflammatory disease.
And what are the symptoms that one should look out for in this situation?
So again, the symptoms would be anywhere between a patient come with severe fever, she might have nausea, vomiting if there is an acute inflammation. Otherwise, she usually, the first complaint that she comes with a vaginal discharge, of increased vaginal discharge, which can be foul smelling, or it can be copious in quantities with a green color or yellowish color. Apart from vaginal infection, she might have irregular vaginal bleeding. So she can bleed premenstrually or throughout the periods, or postmenstrually, or a postcoital bleeding. Even after a sexual intercourse, a patient can have irregular abnormal vaginal bleedings. So, and again, fever and nausea are also quite common.
So how is it diagnosed?
Again, acute pelvic inflammatory disease is a symptomatology. Like we first, when the patient comes to us, we ask her what are the symptoms that she's having, and we also take a medical history and her sexual history, or any recent instrumentation, or any miscarriage, or any coil insertion. Of course, coil insertion, the multi-load or copper T, usually it doesn't cause a pelvic inflammation, but sometimes even the doctor uses a very meticulous aseptic technique. There is still a chance of having a pelvic inflammation. If it occurs in the first 3 weeks of insertion. So we ask the history, and then we try to examine her, take a vaginal swab and see under the microscope if she's having any infection. If the swab is positive, then we do treat her. And we also do an ultrasound, again to check for the uterus, ovaries and the infection, and then we do a blood work, a urine test, and very rarely, if there is any abscess inside, we do a laparoscopy and we drain the abscess.
So could there be any long-term complications arising from pelvic inflammatory disease?
Very good question, yes. So pelvic inflammatory disease has some women actually, the infection is very subtle they might not even know that there is an infection, but in others this causes a devastating reproductive damage.
Okay.
So, the most important long term complications are, first one is an ectopic pregnancy. Have you heard about ectopic pregnancy?
No, doctor, if you could just explain to us about that.
So, normally the pregnancy happens in the uterus, but ectopic pregnancy is where the pregnancy, the fertilized ovum, because of the tubal infection, it gets blocked in the tube, and then pregnancy starts growing in a tube. Tube being a very
outside
small
the uterus.
Yes,
then. Okay.
outside the uterus.
Okay.
So, tube being a very small organ, it cannot hold the growing pregnancy. So, it ruptures and it causes torrential intra-abdominal bleeding, and it is a very life-threatening condition for the women. So, that is the reason why we take care of these women with pelvic inflammation with immediate treatment. So, that could be one long-term complication, and others being the chronic pelvic pain that I have discussed. So, patient has a sequence of continuous or intermittent pain. It is even not relieved with medication. So, and long-term other complication is infertility, failure to conceive. This is again because the tubes are blocked and tubes are damaged by this infection.
Okay. And since this could also be a part of a sexually transmitted disease, do you think the partner also needs treatment in certain cases?
Yes. So, definitely a partner has to be treated. Any partner, any women with a pelvic inflammation, the partner who is of more than 6 months with her, this partner should be treated.
Okay. And what is the course of treatment? What are the treatment options available for this?
So, usually if the patient comes with a mild or moderate pain, and if she is diagnosed with a mild pelvic inflammation, we do give her oral antibiotics. The course will be usually for 2 weeks, but I do ask the patient to come back in 3 days to see if she is getting better. If she is getting better, that is well and good, we follow her up. Otherwise, if she has higher symptoms like any fever, vomiting, or she is not responding to the medical management, it is a time we admit her to the inpatient therapy and we give her intravenous antibiotics.
Okay, so ideally within 3 days, if the symptoms subside, it's okay, otherwise they need a follow-up. And doctor, any tips on how to reduce the risk of getting this disease?
That's really good that you asked it, because it's very important that we prevent acute pelvic inflammatory disease. The most, because it's a sexually transmitted disease, the most important preventive measure would be practicing a safe sex. That is, use of condoms is really important. And then have a check for sexually transmitted infections every 3 months with your doctor to make sure if there is something else, get treated immediately. And also many women, they try to douche, that is vaginal wash, they try to use vaginal wash, and I would suggest do not use vaginal wash, because vaginal wash eliminates good bacteria in the vagina, and that's the reason why women are more prone to infections. The acidic vagina loses its acidity and becomes alkaline, and it's where she gets the pelvic inflammation.
It's better to avoid vaginal wash.
Correct.
Okay, because these days you see this being advertised, and you know, a lot of us tend to buy this and thinking that it's more hygienic and it gives more protection.
Even guidelines say that do not douche.
Okay, okay. And doctor, as I mentioned earlier, you've authored a book on health screenings. So I guess we can talk a little bit about health screenings, which are very important for women of all ages.
Right.
So if you could just tell us a little bit about the health screenings and what are the options available, and at what age they should go for the screenings.
Yes, definitely. So again, every woman should see her doctor at least once in a while. Just not when she has a problem and visits a doctor. No, I would suggest that every woman time to time annually should see the doctor, because when we do some screening is nothing but finding out a problem even at its very beginning stage. Even when there are no symptoms and signs, you track a disease and treat it. So health screenings are very important, and as a gynecologist of 23 years experience, I do understand that women's health is beyond reproduction.
Obviously.
Yes, and Bahrain is such a beautiful place, and it's a melting pot of multicultural ethnicities. So I do see people, apart from Bahraini women, I do see Egyptians, I do see Pakistanis, Indians, and also Americans and Indonesian Filipino patients. So these patients are very well educated patients, and they do want to take care of themselves. So the women sitting in front of me in the clinic, how best she can get her health and treat her health in better ways, the awareness that she has, the resources that she has. So we do create awareness in the women, and the life stages of women are usually divided into 3 stages. One is young adolescents in 20s, the other one is a reproductive age group, women in middle age like 25 to 50s, and 50 plus like a menopausal age group. So each age has different set of screenings that they should do. Coming to the adolescent age group, like in 20s, this is a very young age, and they are highly prone for any interactions with the public and the newer partners, and they need to come to the doctors because guidelines recommend that at least they should have in this age group 2 annual physicals. Annual physicals are when the patient, when the youngsters come to us, we do a blood pressure checkup, height, weight, BMI checkups, and we check on their vaccination statuses, and if there are any lagging behind like any HPV vaccinations, we do ask them to take the vaccinations. And also, since they are more prone for sexual activity, we do also a sexual STI screen, sexually transmitted infection screens we do for them. And apart from these youngsters should have a eye checkup, a dental checkup, and screening, cervical cancer screening is not started until after 20s. So we don't do a cervical screening for them, but they definitely have to go visit a doctor for a skin checkup. So it's American College of Dermatologists say that health checkup for a skin cancers like melanoma, you should visit a doctor. Have you heard about the acronym ABCDE?
Not
for
really.
melanoma?
No.
It's very interesting. A is like asymmetry. Look out for any mole or any lesion which has asymmetric growth, and B is for borders. If the borders are bumped or jagged, you have to look at that. It's a suspicious mole. So C is for color. If the mole is pearly white in color, pink or black, then you have to watch out for that mole. And D is for diameter. Any mole which is bigger than a 6 millimeters, like erasers, small pencil eraser size, you should look out on that. And E is for evolving mole. If it grows rapidly, then again that's suspicious for melanoma. So these are the important things which as doctors we do look in the skin treatments.
So in your observation, what is 1 or 2 of the most important screenings and tests that any woman should go for?
Yes. So that's about the adolescent age group. When coming to the reproductive age group, we have a couple of other screenings. The first and foremost one screening I would say is a cervical cancer screening. So lately WHO, the World Health Organization, has called for cervical cancer elimination, that is from the globe. They have strategies for each country. Now the numbers are 90, 70, 90. 90 is 90% of teens should be vaccinated with HPV vaccination. 70% of women should be screened with a pap smear or HPV DNA, and 90% of women with invasive cancers, they should be treated. So at Al-HILAL, we are doing regular pap smears. We are also doing HPV DNA. So we are aligned with WHO strategies, and we are trying to do our best in creating awareness to the women and also treating them. So this is one screening that we do. Apart from cervical screening, these women also have to have other screenings like a breast mammogram. It's very important. So again, American College of Guidelines say that around 40 to 44 years it's optional for a mammogram, but 45 to 55 is a real age where the breast cancers pop up. So that's the age where you have to go for a mammogram. So yearly, after that, annual or alternate years mammogram is okay.
That's enough. And what about women who fall in the age category of above 55 and 60? Are the screenings the same, or is it different for them?
Some screenings spill over to there.
Okay.
Apart from these screenings, they also have a colonoscopy or a stool test, and they also have a bone mineral density, because that's the age where menopause sets in, right? So women may have hormonal imbalance. So bone mineral density test is what we do, and mammogram spills over for some time there too, and cervical cancer too. After 64 we stop cervical cancer screening.
Okay. So thank you so much, doctor, for that very informative session. You had the patience to explain to us in detail about all these issues. I'm sure our viewers will find this very helpful. So before we wrap up, any takeaway message for them to prevent future health problems?
Sure. So, it's always important that you remember 4 important numbers. One is your blood pressure. The normal should be 120/80. Anything above that or below that, to visit a doctor. And the next one is the BMI. BMI should be anywhere between 18.5 to 24. More than that or less than that, it's very important to maintain an optimum BMI for proper hormonal control. And then the LDL, that is cholesterol, it should be less than 130, and your blood sugars less than 100. More than that or less than that, again you have to see your doctor. So at Al-HILAL, we as a team of doctors are doing the best evidence-based and patient-centered management. And if you come with a problem, sure you will find a solution with us. And do meet us. We are at Manama, and we have also other branches. And I am Dr. Krishna Ramavath. Thanks for having me here in the show, Anupama.
Thank you so much, doctor, for taking time out from a busy schedule to join us today. Really appreciate it. Thank you so much.
You're welcome.
So viewers, I hope all of you found this episode very informative and useful. For more informative episodes like this, don't forget to tune in to BMC Global Live Al-HILAL Health World every Tuesday at 8 p.m. To all the wonderful ladies listening to our show, please make your health a priority, because only if you are in good health, you can take care of your family. So stay healthy and happy always. This is Anupama signing off till we meet again next time. Good night.